I did say that we want to talk about hair loss, and I have with me Letitia Kuda Mupawose. She's a trichologist, and that simply means she's a hair doctor. And she joins us as we want to talk about hair loss. Kuda, how are you doing? Good afternoon, and thank you so much for joining us.
Thank you, Glenda. Thanks for having me.
It's great to have you on the show. Maybe you could start to just unpack to us the normal hair growth, a natural cycle. How does it go?
Okay, so under normal circumstances, the hair has about 5, if not 6, because there are 2 new life cycles that have just been discovered. And they lasted from 1 to 5 years. So there is what is called the growing phase, which other people scientifically would name it anagen. And then there is the regressing phase, which is a catagen, and the resting phase, which is a telogen, which is what we have known all along. But there have been new discoveries that there is actually other 2 more life cycles. But for purposes for other people to really just understand, your hair has a stage where it's growing, and then there's a stage where it has stopped growing, and then there's a stage where your hair that had stopped growing removes itself from the hair shaft, and then it dies. So basically, when it dies, that's where you have a hair fall. That's the natural cycle, and it usually lasts maybe up to from 1 to 3 years. Other people have that life cycle for 3 years, and others have got 5 years. But the beauty about it is, if you don't want your hair to go into a resting phase, you can keep your hair in the anagen. That means you do things that stimulate your hair to grow. So your hair keeps on being on anagen. So instead of the hair resting, so you find some people say, oh, my hair was growing so much, and then now it doesn't seem like it's not growing. It's true. It will not be growing. That's the resting stage. And then suddenly that hair falls. So the key thing is to know when your hair is in anagen, and then you keep stimulating it, then it grows.
All right, help us understand, teach how to stimulate it so that it grows when it reaches that resting stage. What are we doing here?
Okay, so take, for example, there's so many products on the market that makes your hair grow. So that's the stimulation. Suppose you're doing it at home, you don't have money to buy anything, so you're massaging your hair every day. So basically what you're doing is you are constantly feeding your hair with blood. So the blood, it circulates around your hair follicles. By so doing, it brings in more and fresh nutrients every day. So when somebody just massages your hair, suppose you don't have any product and you're at home, you just massage your hair every day. What you're basically doing is you're stimulating your hair every day.
Okay, very interesting.
So it's important to constantly be massaging your hair. That's a hair stimulus.
Wow. All right. I didn't know. This is very interesting. So very critical for you to do that every now and again. But I think a lot of us would rather keep our hair under wrap, if you know what I mean, Kuti. Maybe it's a challenge in that regard, Kuti. It's at that stage where it's not growing, and it's a bit difficult to manage, so we'd rather keep it under wrap. Is this a good idea to always keep your hair under wrap, whether wearing a weave or whatever?
The thing, especially if we're talking about black hair is very fragile. So if you keep your hair on protective hairstyles, now that depends on what is protective, because sometimes people put braids in hair. Braids, depending on how they are done, they're not always protective hairstyles. So by covering your hair, what you're doing is you're not necessarily growing your hair, but what you're doing is you are retaining length. Because sometimes we say black hair doesn't grow, but it actually grows. But as black people, we don't know how to retain length of our hair. So when I keep my hair wrapped up, and I'm not manipulating it every day, I'm not combing it every day, I'm not touching it every day. So basically what I'm doing is I'm having my hair to grow all the time. So if you want then to stimulate your hair, suppose you've got your hair under wraps, try and stimulate your hair by massaging your scalp every day. So what it then does is it grows your hair, but at the same time, your hair is able to maintain retention of length because you're not manipulating it every day. So a combination of the two will result in you having long hair.
Wow. All right. So I don't know if it's a myth, but I remember growing up, people would actually say wintertime, braid your hair so that it's protected. Help us unpack this.
Okay, so when your hair is protected, which is literally what I've just been saying, it's protective hairstyle. So that means that when your hair is, you've got the mabanzi or you've got your hair braided, what it means is you're not combing your hair every day. So when you do not manipulate black hair every day, you tend to get retention. So then it will appear as if your hair has grown longer because you were not touching it every day. But your hair has not stopped growing. Your hair pattern of growth is the same unless you do the stimulation that I'm talking about.
All right, interesting. So if you just joined us...
It's just that it looks longer.
Ah,
Sorry?
Okay, I understand. I was trying to figure out that bit. But yeah, it makes a lot of sense. 0719 100 404. If you've just joined us, we're in a segment that we call We Need to Talk. And on the line with me is Letitia Kuda Mupawose, who is a trichologist. And that simply means she is a hair doctor. And if you're having challenges with your hair, share your concerns. And if you have any questions for her, she'll be able to address them. So you did go through the hair growth natural cycle. At what stage then Patnuita hair loss is it considered a concern?
Okay, so every day, each person, remember I talked about that growth cycle. You must always have that in mind, that your hair does not grow at the same time. When I say your hair is going to be on the growth span, it means that there is new hair that's growing, but there is also old hair that now needs to be falling out. So every day, each person loses up to 100, maximum maybe 100 hairs every day. So suppose you have your braids and you have your braids for a month. That means in 30 days, you've been losing hair every day. So if you say 100 multiplied by 30, so by the time you undo your hair, you're looking at about 3,000 hairs that has fallen out of your hair. That is normal. But then for other people, they get scared thinking that, oh my God, this means my hair is falling. No, it's just that you've kept your hair in a protective hairstyle, so you're going to have so much hair that has already shedded, which is a normal process, and that's the hair that's going to come out. When do you become worried when you're losing hair? If suppose you do have, remember, you've got at the back of your mind, you've got 3,000 hair that should have come out of your hair. If you feel that there's more than 3,000, then you have a right to worry. Or suppose your hair is not protected and you're losing a full strand of hair every day and you're seeing hair all over the place, that means you've got a reason to worry. And then there's another type of hair loss where your hair is breaking off. It's not the whole strand of hair that's coming out of the scalp, but you find that your hair is, every time that you comb, you've got this little bit of hairs. That means it's a sign that your hair, there's something wrong with your hair, or it could be a sign that there's something wrong with you, you're healthy. So that's when, so always remember, you lose hair every day. If you don't comb your hair for the next 30 days, you're going to have over 3,000, maybe 3,000 max. But if you've got a little bit more, then you've got every right to worry. And then how will you know? You can actually do what we call a pull test. You can actually yak your hair, because if your hair is strong, it should be able to be yacked out. You pull, it's called the hair pull test, and then you pull it a little bit. You should have no hair or just the normal hair. But if you do the pull test and you've got a chunk of hair, then that means there's a problem.
All right, please help us again. Can you just repeat that process? How does it work?
Okay, so bearing in mind that everybody loses hair up to 100 every day. When you see that you're losing more than 100, you can do at home, you can do what I call hair pull test.
Mm-hmm.
So you hold your hair and you pull it like you're yanking your hair. Not too painful so that you can harm yourself. Not too painful that you can actually yank out the good hair. But just enough just to pull a little jack on your hair. On your hands, they should not be more than the natural hair loss. Natural hair shedding, not hair loss. Natural hair shedding that I talked about. If you see that suddenly you've got a chunk of hair that has been pulled out, and usually it's pulled out, it's a whole hair strand, that shows that there's a problem.
Mm-hmm.
Or if your hair is, like somebody will just say, been to the barber. If you touch your hair and you pull and your hands are full of those tiny little pieces of your hair, then that means also there is a problem.
Okay, I think Pajeka Paningeta Pabata Ipapo. Now, in terms of hair loss, Kuda, what are the types that are there?
You know what? There's so many types of hair loss that are there. There is, I would put it into 3 categories. There is what we call androgenic alopecia. Androgenic alopecia, that's where when somebody says, oh, it's heredity, my auntie was like this, that means it's caused by hormones. So it's a hormonal, and you find that if you're a woman and you have what is like a male type balding, that means you've got a lot of testosterone that is turned into dihydrotestosterone. Okay, so for purposes of understanding, the testosterone turns into DHT. So the DHT is a hormonal disorder. That means you've got a lot of male hormones. And then what it does, it then causes you to have the bald typing. And then there is another group of hair loss, which is under inflammation hair loss. These are people that have got scarred. It looks like your head has been scarred. It's like it's shiny. Sometimes it's sensitive to touch. So that means there's a disease under, and that is causing the inflammation. And there's a whole lot of hair loss types under that. And then there is nutritional hair loss. That means it's something to do with some nutrients that are lacking within you. Take, for example, if you are pregnant and then you've got so much hair after you've given birth, then the nutrients have gone. You're no longer feeding yourself with ions. You're not taking the nutrients anymore. So you find you have those issues. Suppose you've got a disease that is causing. And so remember, hair to our body is not life-giving. So if there's something wrong with your body, all the nutrients, life-giving nutrients, goes to life-giving organs. And hair is considered the least one. So there is a whole lot of them. I could name up to 23, but I think there's a bit more. But the common ones are up to 23. But the common ones on black people, especially, it's traction alopecia, which is caused by what we do. By manipulating your hair, the braids that you're doing. Chemical alopecia, that means the chemicals that you're using. Some hair colors that you use, relaxers that you use, all those, they cause traction on our hair. There is autoimmune, which is alopecia areata. That's an autoimmune disease that causes your hair loss. It's also part of another group of hair losses. That is, suppose you've got lupus, suppose you've got cancer. All these are different types of hair loss that you can get. And at the same time, you find a lot of people say, I have alopecia. Alopecia is just a medical term for hair loss.
All right. Someone comes through with a question here. But before we jump into the WhatsApp platform, remember, you can also send through your questions We have an expert around Nyaya hair loss. Letitia Kuda Mupawose is a trichologist, and she's helping us dissect this one. And I wanted to know, Kuda Kuti, does it differ between men and women? Takatasa na uyo hair loss.
It differs, not so much, but the fact that what differs is that a lot of guys, they start losing hair from 20. So if they've got a lot of DHT, if they've got a lot of male hormones, which then turns into DHT, it means that they're producing a lot of testosterone, and lack of use of it then causes it to be DHT. So there is a lot of, so you find that those are the guys who loses their hair. But then when it comes to women, they start, if they're suffering from DHT also, it starts from 33. So for guys, you see it more from 20 going up. For women, we start losing hair. If it's got nothing to do with our manipulation, if it's not traction, if it's not an inflammatory disease caused the hair loss, you'll find that a lot of women start losing hair when they start at 33 going up. So as you get older, it becomes now the male gene in us becomes active. Okay. Which then causes the DHT.
All right. Someone then comes through, says, I am a young man, 32 years of age, and I'm already bald. What might be the problem, and is it possible to get the hair back, and how?
Okay, so for, you said you're a young man, right?
He says, I'm 32 years. I don't know how, if we could actually classify him as that, but he's younger than me, so he's young. 32 years of age, says already
so for
bald.
A guy, so you find that a lot of people who have androgenic alopecia, which is what this guy has, it's a hormonal, and there's not really much, and it's hereditary, in the sense that it's within his gene. So in his genes, they produce a lot of testosterone, which then is turned into DHT. So ordinarily, I would say that he's going to go on to death with hair loss issues. But however, he can actually control the DHT and then have his hair. So there are so many products on the market where he can actually start using the shampoos that are on the market. There are DHT blockers on the market. So as long as he is blocking the DHT from miniaturizing his hair follicles, that's like, it's almost like the DHT eats up your hair follicles. You know, like the seed of your hair is being eaten up, and it becomes shrunk and shrunk and shrunk until he now has the balding. But if he starts using the DHT blockers, he will be able to get his hair. But what it means is he will continuously be using these products for as long as you want his hair.
Okay, nice one. Hi,
because
ladies.
It's within his genes.
Okay, great. Someone says, hi ladies, inindane makore ndichiruka vhudzi rangu but rinokura mbichana ende rishoma uye rinodambuka ndodi kuti rikurewo ndatambura naro rinogara ndakasunga dhuku zvingava izvo here zvinokonzera kuti risakure. Yemu right here in Harare coming through with that one.
I would say maybe do not, because remember, hair is feeds just like any, you need to feed your scalp. Maybe the problem is your scalp. It depends on what is it that she's putting. A lot of hair foods out there, they clog your pores. So, I'm talking from experience, having worked in a hair salon, being a hairdresser myself, you find that a lot of hairdressers test petroleum-based hair food on the scalp. So by doing that, instead of getting the hair shaft to be fed by whether just the water or just the breathing, you find that it's always sucked up, it's always closed up, your hair pores are always closed up. So there's a lot this lady can do to do maybe scalp treatments, just to stimulate your hair, to take care of your scalp. She would then be able to actually start seeing growth. Maybe what she can actually start doing is just to spray water, like water, instead of putting a hair food. When she feels like putting hair food, she must put water and then stimulate her scalp. That's massaging your scalp. She will be able to get the growth that she wants.
All right. So
or maybe her hair is actually telling you that she's got a problem.
Hey. All right, so I was also trying to figure out something here as you were talking about the whole issue, my hair food, because we might be getting it wrong somewhere as well. Pamwe it will stop the issue of dandruff. Is there a connection somehow ne my hair food?
When we talk about dandruff, scientifically or medically, dandruff is when you remove the crust, and then there's blood underneath. That's dandruff. So are we talking about the dry hair? Dry hair is when you get all this flakiness on your scalp. So which one are we talking about?
The flakiness in your hair. Maybe because I'm not too sure.
Okay, so
but I'm trying.
So I'm gonna ask you I'm gonna answer you, but I'm gonna start asking you with a question. If you are thirsty, what do you drink?
I drink water.
You drink oil or you drink water?
I drink water.
Thank you. Same thing. Hair is an extension of skin. Your hair, it's when your scalp is dry, what it needs is moisture. Do you moisturize with oil or you moisturize with water?
Oh my God! I think I get you here, but in most of the time, this is because I have a problem with dandruff, and the most okay, I thought it was the most logical thing for me was to put hair food, because I'm thinking it's dry, it needs a little bit of
So if something is already dry and you put oil on it, what does it do? It dries even more, right? So some of the things that we think are dry hair is probably product residue. If you're a guy and you've got dry scalp, it means that you're overly washing your hair with soap, so there's soap residue that when it dries up, it starts flaking, and you think that you've got makwene or dandruff, whatever that. I'm putting dandruff in quotes. It's not dandruff. Dry hair.
Okay.
Flaky. Same versus with you. When you feel like your hair your scalp is dry, you're oiling it. But what you need is not oil. What you need is water.
All right. Duly
but
noted.
Then somebody will say, oh no, but once I put water, then it dries up immediately. That means that all the water, so I would do I'll take the water spritz. When I say spray water, I don't mean go under the shower and drench it. Because once you do that, it just runs through. So take a mist and spray your scalp little by little so that all the water is absorbed. Obviously, when you spray water and your scalp starts tingling, itching, it means it's actually telling you that we were dry, and it's responding to the moisture. So you should keep on spritzing until the scalp calms down.
I've learned so much today. I'm so blown away. But anyway, let me just quickly get into the inbox before I throw a few questions to you before we shut it down. But I know we've barely scratched the surface here. But someone says, Hanzi nini pakachpem soro apa. I don't have any hair, but the rest of my head is okay. And she's...
the next person...
Uh-huh.
The next question that I would ask that person is, how does she maintain her hair? Because remember, like I said, the guilty is charged, because I also used to do this. When I don't know how she maintains her hair. Maybe she does weave. a lot of hairdressers, when they are braiding for weaves, they do it in circle motion, and they end up at the top of the head. Or some start from the top of the head going into circle motion. And when they are putting the weave, that's the last part. So literally, when you are doing your circling motion, when you are braiding the cornrows, you're taking away the blood, right? Away from flowing totally nicely. And then you then come in again, you put your weave, and you last at the top again. So literally, what it means is a lot of people think that, oh, they've got a hair problem, but it's actually how their hair is being done. Because once you choke, if you tie something down and you choke oxygen, and you choke, because I mean, when I say oxygen, the blood comes in with oxygen. But then there is no blood circulating in that little corner because of the circle motion that they do. What happens when there is no blood flowing? What happens? Something dies, right?
Mm-hmm.
So she needs to pay attention. How does she maintain her hair? And sometimes some of the people actually have, like if you're wearing a wig all the time, I challenge you to go in and look through and see if you don't have a wig line, almost like a dent that is now around your hair. So basically, if there was waves there that used to be normal, that means now they are thinner. So there is less blood that's going to your scalp. So that could actually be causing your hair loss.
All right, interesting. But she comes through, says, Doc, I do not do weaves. I do my carpet. It's carpet. I may not find a word for it, but I say carpet. Carpet.
Yeah.
This was.
So basically, in a way, I don't know who braids her, but chances are they either, because if she had said, I don't have hair on the center, it's sore to touch, it's itchy, so that could actually, maybe we are now going towards the inflammation that I was telling you about.
Okay.
But it's also then, it'll be even better if I were to do a consultation and see the person, then I can say, oh, okay, fine. So if she's sore to touch and there's no hair, so she could actually be developing maybe a CCCA. It's another type of alopecia that starts from the crown and it spreads onto the center of the hair. Ideally, that person, I would say, stop braiding your hair, start massaging, start spraying water on your scalp, and let blood come back onto that.
Okay, interesting. But we have...
So you then go in for consultation.
All right. So we also need to understand about consultation. And how do you diagnose hair loss? We might have to shut it down for now, but a few questions that I need to squeeze in here before I let you go. Hi, Glenda. Ask Doc, and I'm a male, age 30, and I'm starting to see new strands of white hair. What's causing it? Isn't it a bit too early for that?
Well, the reason why people don't have hair or when the hair starts, it's graying, it means that it has lost its pigmentation. So it could be stressing, it could be, there's a lot of other things that could be causing that. So I wouldn't worry. It's not too early, it's not too late. You find there's a lot that comes into graying. And there's not really much out there that people can do when your hair is graying.
Mm-hmm. But
it might be too early. It might.
Could have kuti maybe because someone comes through says in gray when I was in my 20s, child, and naomboisa angu die.
Well, for me, I actually started graying when I was in grade 7. I've got a little white, they call it Ndorochina or whatever. And of course, I then went on to the colors, but there's not really much you can do about your hair losing its pigmentation.
Mm-hmm. All right, Doc, I have to
Yeah.
let you go because time definitely not on our side. We have to pick it up another day. But as well, thank you so much for coming through to help us with this one here. We might have to have a part 2 of this conversation. But thank you so much.
No problem. Thank you for having me.
All
I
right.
hope I helped one or two.
You helped me. I know for one that I've learned quite a thing or two here. But as well, I know a lot of people have also heard what you said and have learned quite a bit. Thank you so much for your time. Looking forward to having you on the show next time.
Okay. Thank you.
All right. So there you have it. It has been We Need to Talk. And I was with a specialist in the issue of hair loss. Her name is Letitia Kuda Mupawose, who is a trichologist. And we've been talking about hair loss. So we might have to have a part 2 of this conversation because we need to understand how hair loss is diagnosed, treatment options that are there for hair loss, among other issues, simple hair remedies, home remedies that you can do at home to ensure that you don't have this problem. It's been absolutely amazing hanging out with you. I'm back on the station on Tuesday, that's tomorrow, between 12 and 3. Stand by for Loshto. He's all yours.